Orkneys are actually an archipelago or string of around 70 islands, 20 miles north of the Scottish mainland, separated by the Pentland Firth, but lying in the North Sea. The main island, Orkney, is remarkably isolated from Scotland. When the COVID-19 pandemic struck, it became even more isolated and had to become innovative in its use of modern digital technology. Debs Crohn, a professionally qualified health and social care strategic leader, had already been appointed head of improvement, and her husband, Nick Crohn, a trained radiographer, is the manager of radiology, audiology and laboratory services in NHS Orkney. We are now going to hear how they have improved NHS services in Orkney with digital technology, including telemedicine, digital pharmacy, mobile radiography, including visits to adjacent islands, and the use of drones. Orkney is teaching us a lot, and Debs and Nick have a great presentation. Over to you, Nick and Debs.
My name's Nick Crohn. I'm actually a radiographer. We don't have any radiologists up in Orkney. We get supported by Aberdeen. So I manage the radiology department, the audiology department, clinical physiology, basically all the ologies. We're a small hospital, and most of us have multiple jobs. So, and I'll let Debs introduce herself as well.
Good afternoon, I'm Debs Crohn. I'm Head of Improvement here at NHS Orkney. You might have made the connection between Nick and I, and yes, we are married. We're definitely husband and wife. I can absolutely confirm that. So please don't be confused by our accents, because when people think you live in Orkney, they all think you've got a Scottish accent. Well, actually, we're from Yorkshire. So we moved to this beautiful place, and I'll let Nick get the presentation slides up while I'm saying this, but we moved to this wonderful archipelago just off the top corner of Scotland 5 years ago, just before COVID hit. I moved up to be head of digital transformation for the board, and COVID hit. And at that point, Scottish Government were looking for leaders that were based in digital solutions to be part of the national vaccination programme for Scotland. So the past 3 years, that's what I've been doing. But I was asked to return back to NHS Orkney earlier this year to head up our improvement function. So bringing my digital expertise and all that knowledge that I've got around digital and data in with improvement, which is fabulous, and it's really moving things forward. So Nick and I are going to do a bit of a two Ronnie's double act on the presentation, and we will make sure that we'll leave some time at the end for questions. So Nick, over to you.
What we want to talk about is how we're bringing healthcare closer to patients' homes. As has been mentioned, we're about 70 islands, just 35 miles north of Scotland. We're usually in a little box off to the side of the map, and 20 of the islands are inhabited. We have a boat and plane transport network across the islands, but being off the north coast of Scotland, that can be quite challenging at times, to say the least. Our main hospital is the Balfour. It's located on the Orkney mainland. We have a population of around about 17,000 on the mainland, and we are the smallest health board in Scotland. We have, to support this, permanent GP surgeries on West Street, Sandy, Hoy and Stronsea, and they support the small populations that live out there. But the problem is all of these patients are on islands, and we're on Orkney mainland, and our big tertiary centre is in Aberdeen in mainland Scotland. So for us, one of the big things is around off-island travel. That is the big problem we have. So for some of our patients, if they're, for example, going for an appointment at Aberdeen, they can have 12 hours of travel, or potentially overnight travel as well. So even to get to the Balfour, for some of our patients on the islands, even the closest one, Hoy, you're looking at 8 hours. So transport away from home is a big issue for us. If they're going down to Aberdeen, we can be looking at 72 hours for some of our IELTS patients, that they'll need overnight stays in Aberdeen on the Orkney mainland to make sure that they get connections to flights and ferries. We've had a lot of drivers from the UK government and our professional bodies to make particularly imaging much more accessible to our patients, to make it closer to home. That I know for many years we lived in Hull, and it was even a challenge for patients getting to the main hospital for a lot of the tests, even in a big city. So as you can imagine, for our patients, it's really, really difficult. We also have an issue around accessibility. I'm guessing most of you have been on a plane. For us, the only access to them is stairs. And for some of them, it's a little aluminium ladder that drops out of the 6-seater if you're going to one of the islands. So for our patients with poor mobility, it's a real problem. And it's the same on the ferries. Very often our patients need to stay in the car while they're travelling over to the mainland. A big thing for island populations is their interdependency. So as you can imagine, looking at some of the numbers of people that are living on those islands, around 60 to 70% of them are going to be elderly or retired. And that means that a big chunk of the jobs that you would normally expect in a community are down to a very small number of people. I've got 3 jobs and we're on the Orkney mainland. On the Isles, it can be people getting up, starting on the farm, working in shops, etc., etc. But I'll tell you a bit more about that as we move on. The other thing is the island mindset, that we do occasionally encounter patients who have never actually left their islands. Now, this isn't unique because we're living on an island. It does happen in a lot of communities that people won't travel outside of their own village, their own town, their own city. But for us, it becomes down to the point of some patients will only have been in, for example, one lady had never been to the south end of Sandy. The island's only 5 miles long, so quite a very narrow definition of what home is. So what did we want to achieve? Part of this is reduction in travel and sustainability. That our patients, for them, it's a big thing. And we're also using a lot of fossil fuels, etc., sending these patients south. Debs will say a bit more about how we're getting the sustainability of transport going, though. We want to improve attendance and subsequent diagnosis. We did find around about 70% of patients on the islands will either cancel or not be able to attend their appointments. We want to be able to meet our national and our professional expectations. And one of those is ensuring that we make imaging happen closer to home. So that was a big driver for us, and improving our patient experience. The experience of travelling on a ferry to mainland Orkney and then on a plane to Aberdeen in the middle of winter is probably one that I wouldn't wish on my worst enemy. It's absolutely horrendous. So we want to try and reduce that as well. And improve recruitment and retention of staff. It's always good to have a job where you're doing something a bit different and you get a chance, particularly for radiographers who usually get left in a darkened room for most of their careers. It's nice to get out and about, go and visit and get to know our primary care colleagues. So we have set up an IELTS imaging service. So we have, and it's on the picture here, it's a fully portable X-ray unit. It has PACS and RIS, so that's the picture archiving and communication service, and RIS is our radiology information system connectivity. and it's capable of doing up to 100 chest x-rays. So we can get quite a lot of work out of it. Image quality, it's pretty comparable to what we would get in an x-ray department. The equipment is pretty much the same. We also invested in a portable ultrasound unit. Again, really small piece of equipment, carryable by one member of staff, and can go with them out to the aisles. And the probes and images produced are the equivalent to those on a scanner in the main department. I will confess we do sometimes use it as our backup in the department. So our challenges, the big challenge was the cost. The equipment for both pieces cost us around about £100,000, which is a big chunk of money when there isn't much around. However, that does offset against our patient travel, the time it's taken, and the risks we would encounter with patients not engaging with healthcare. Travel, it works both ways. Patients coming to the island or us going to the islands. The weather's not good. In summer, availability is quite limited due to the number of tourists. And of course, I, being one, am quite travel sick. So for some of our team, it is a bit of a challenge, but one that we're willing to go with. Initially, the equipment was quite heavy. We've managed to get it down to equipment that will fit in a single backpack. So that means we can now, rather than relying on the ferries, actually take it on the plane as well. So we can be up and back to the GP surgeries to see the patients in less than an hour. The X-ray equipment, it's not particularly powerful. It'll do chest X-rays, but, and this sort of links to the next point, managing the expectations. When you have the aisles practitioners and GPs saying, well, can we get hip X-rays done on a patient so they don't have to go to the hospital to see if they've got a broken hip? It's not that good. So managing the expectations was a fairly big thing for us. One of the biggest challenges we faced was around the IT access and getting work lists, uploading to packs, and live reporting became a massive challenge for us. But what this actually means when we have this running is that we can give pretty much a one-stop clinic on the islands, and patients can get their information very, very quickly, almost a point of contact with the GP. We also work with the team down in Grampian around AI identification of suspected cancer. So the potential we have is that we can actually give patients either an all clear or other information when we're actually out on the islands to save that worry and wait for them. So we reduce travel. In some cases, just as an example, if we're going out to do 10 patients, that's 10 journeys as opposed to one journey as opposed to 10. We reduce non-attendance. So everybody from the Isles is coming for their X-rays. Much better patient experience. We had one example of a gentleman who had a problem with his foot. He had to be brought into the GP surgery by his daughter, his son. His son was the local delivery man. His daughter worked in the shop and the school, and they both ran a dairy farm. So basically the school, shop, and all deliveries would have to stop if a dad came to the hospital. We managed to see him. He got treated on island. We went back 2 weeks later and he came in under his own steam, which was fantastic. We've reduced that for 8 to 12 hours travel down to 15 minutes. Patients, for most part, can walk to the GP surgeries. We've improved our relationship with the primary care, and it has given a boost to getting the IT improved. And the staff are a lot happier. Having a trip out to an island with some beautiful beaches, lots of archaeology, and lovely wildlife as part of your working day is absolutely fantastic. So I'm going to hand over to Debs. She's going to talk about how this project and others have benefited from improving our communication.
Thank you, Nick. There is a couple of questions in the chat. If it's okay, we'll pick those up at the end. I think it's Stacey that's got a question there, but yeah, let's do that shortly. So Nick, if you want to scroll through the narrative for me. So as you can see, that's me sat there with my laptop in Westray, which is one of the furthest isles away from Kirkwall. I'm demonstrating there that you can actually do a Teams call in Westray using your technology. We've invested in lots of high-speed infrastructure for our IT, and one of the things that we've done in Orkney is to partner up with one of our local providers who provides satellite internet access, which has been absolutely groundbreaking and transformational for us. If anybody's as old as me, you'll remember the old modem ding 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 dial-ups. That's pretty much what it was like here in Orkney only a few years ago, actually. So one of the things that we've done to increase that speed is to put in, as I say, the satellite broadband, which is just fantastic, and it does speed things up. We know that we've got challenges around accessing data, and that's been a key theme, I think, this morning, Angus, right through most of the conversations, is access to data for healthcare professionals which are outside the hospital. One of the things that we're doing as part of our priorities this year is looking to roll out a community electronic patient record. Quite a few of our staff are still using the old pen and paper to record patient records, which in the 21st century is totally not the right thing to be doing. And here in Scotland, we're looking at rolling out a digital front door, pretty much similar to what England have got around your app. But also we want to encompass social care as well. So it's not just health data, it will be health and social care data, which I think is absolutely key for places like Orkney, where we know that we've got challenges around getting that data out. So Nick's talked a lot about challenges. I think for me, one of the real opportunities that came out of the pandemic, and one which sadly hasn't been as embraced as I wanted it to be really, is around virtual consultations. We're all on a Zoom call today. Here in Scotland, when the pandemic hit, I was part of the team that rolled out new Microsoft 365, and we brought in Teams, which was just absolutely transformational in terms of how we worked through the pandemic. Here in Orkney, there'd been a little bit of reluctance to move into virtual consultations, and we have a platform in Scotland called Near Me, which is our virtual consultation platform. Some of our GPs had said, oh, I'd rather see patients face to face, and oh, I don't really want to go down that route of virtual consultations. The pandemic kind of forced our hand on that one, and certainly forced some of our primary care colleagues, not just general practice practitioners, but all practice staff, to really think about virtual consultations. And given the remoteness of Orkney, on the leaderboard in Scotland, we were the top performing board for offering virtual consultations. It's really, really transformed the way that we do business. There's been a few pockets where it's kind of slipped back into face-to-face consultations, and that's absolutely fine, and there will always be the need for that. But for us, it's really reduced that need for people to travel down to Aberdeen for appointments. So I've been working really closely with all our secondary clinicians to say, look, if you can use virtual consultations, it's really great. And one of the things someone said to Nick and I when we moved to Orkney was, have you got the internet? Actually, Orkney is more connected than we ever were when we lived in Hull. And that's because things like Facebook and Messenger and all of the above, WhatsApp, is the way that we communicate on the islands. And we've always done that for a long, long time. So I think that's one of the positives working in remote and rural, is that we have embraced technology and are willing to use that. So this is me in Westray, one of those planes that Nick talked about, where the metal ladder pops out and there's 6 people sat on a plane, and it really does feel like you're flying it. One of the things that was a national driver from Scottish Government was around making sure that all our GP surgeries were equipped to use technology. So every practice now has 2 screens in all consultation rooms. We've made sure that they've got the latest equipment installed in terms of webcams, etc., etc. Rolling out digital dermatology is another way of using technology to eliminate the need for people to travel a long way for appointments. Using AI as well, as we've started to roll that out within our primary care settings. I've already talked about virtual consultations. That's been one of the real key things for us. We've also started to use our GP surgeries as hubs. So not everybody's IT confident, and what we were really keen to do was to make sure that out on the outer hours, the ferry linked hours as we call them here in Orkney, that we had key champions within the communities that would act as a patient advocate, that would support people to come into the GP practice for a virtual consultation. And again, we've rolled that out here in the Balfour, so that we've also got some areas, some clinical areas set up that people can come in and see a consultant down in Grampian, but they're not on their own. We've got some volunteers that support that. Again, one of the big things for us is reducing that travel for patients, thinking about our carbon footprint, but more importantly, thinking about the patient. And as Nick said, bringing that care closer to home. Lots of feedback from our patients that better engagement has happened as well in terms of what we've been doing. One of the things I've certainly been really keen to see here in Orkney as part of my improvement role is having those conversations with our patients, really listening to understand what matters to them, and how we can improve the way that we transact with our communities, not just through the use of technology, but also as healthcare providers. Okay, so this is one that I get incredibly excited about. And Angus, I think you and I had a long conversation about this one. You'll have seen on the news that Orkney is one of the pilot sites in Scotland for the use of drones. And at the moment, we've piloted that for the use of delivering mail to the outer aisles, and also for medication deliveries on the aisles. So we've started that pilot. There's been a few hiccups, but that's what tests of change are for. And that absolutely will revolutionise the way that we do things, particularly around bloods and medications, and then how we get those in and out of the aisles, particularly important on the aisles of places like North Ronaldsay, where they only have one boat or one plane a day. So really, really exciting times for Orkney in terms of that use of dronage. Again, I think this is one of the common things running through both our presentations, has been that kind of, one of the challenges has been around the cost for equipment, and the real need for certainly our health board to understand that technology doesn't come for free, and there's always going to be an invest to save in terms of moving that forward. And I think that's one of the key messages from me today is, if we are really committed to moving forward the use of digital and data to improve what we do, we absolutely have to invest in that both now and for the future. You can see there, one of the bullet points is around a lot of our surgeries did have decades old equipment, and we've certainly had to invest in that. And we've got some brilliant general practitioners that have really, really embraced that and who are really up for the change. And I think my next slide, Nick, if you'd like to click onto that one, is really talking about something that I heard someone talk earlier on, which was around upskilling staff. I'm also the chair of the Scottish Government's Digital Capabilities Board, where we're bringing in a framework for professionals working in digital and data and technology, and really looking at how we can move that forward for Scotland, really upskilling our staff and not just kind of paying lip service to that, but really engaging them and building their capacity and their capabilities for the future. Here in Orkney, we have, it might not sound a lot, but we're a very small health board with 800 staff. We've currently got 23 digital champions that are really advocates for digital transformation, and that's right across the board, from our chief executive, Angus, from Laurascape Knight, who's our senior responsible owner for digital, right down the ranks, through all the way down through the organisation to our domestics, who are, again, brilliant advocates for the use of technology. Those 23 people really going out there and engaging with the business around how we can change things here. When we first kind of did our assessment around our digital maturity, it was quite low. We've worked really hard over the past couple of years to improve our digital maturity, and that's a work in progress. One of the things that we've also committed to doing here in Orkney is having an NHS Orkney quality improvement methodology, really making that fit for purpose for our staff, and we've co-designed that, we've co-produced that with our teams, and we've just rolled that out. So really embedding quality improvement methodology in everything that we do. We also have a Staff Bright Ideas scheme, which is where we encourage our staff to come forward with ideas for improvement and innovation, and that's where one of Nick's, the scheme that Nick talked about earlier, was one of those innovations. Nothing is off the cards. We're very much about come with your ideas, let's give it a go. My response is always, why not, rather than no, you can't. So really, really embedding that real feel for upskilling and investing in staff, because they're our biggest asset in terms of getting our digital transformation over the line.